Hi, my name is Dr. John Petralia, Medical Director of the Interventional Pain Medical Group at New Looks Medical Spa. I'm a board-certified anesthesiologist and pain management specialist, and I'm here to tell you how I help people feel better and look better. As the Medical Director of the Interventional Pain Medical Group, we specialize in most difficult to diagnose and hard to treat pain conditions. I am making a personal pledge to you that we will find and treat the cause of your chronic pain. In the office and in the operating room, our trained panel of experts, including orthopedic surgeons, chiropractors, acupuncturists, neurosurgeons, massage therapists, detox specialists, addiction counselors, and nurse practitioners strive to do our best every single day for every patient. Some of our patients include professional athletes injured in their sports endeavors, people injured in industrial injuries and accidents, those hurt in motor vehicle accidents, people that are just regular folks that work hard for a living and are suffering with chronic pain. We also specialize in failed surgical procedures and the recovery during that phase. I've made this short video to allow you to hear what some of our patients have to say. Please feel free to call one of our offices in the Newport Beach, Orange, Fresno, or Los Angeles or Whittier offices to make an appointment, or visit our website at www.gotpaindocs.com. That's GOTPAINDOCS.com. Our phone number is 866-804-PAIN.
Hi, my name is Jesse Marley. I'm a professional snowboarder. We're doing a photo shoot for a catalog, and I fell really hard and overshot a jump and landed right on my lower back. And I decided to come down to visit Dr. Petralia and Dr. Snyder to use the high-powered laser. They lasered the bottom of the L4 and the L5. And today I walked in with a pain, probably about an 8 or a 9, hurting pretty bad. And after the laser, I'd say I was at about 3 or 4. It really took the swelling down. Snowboarding is my life, and I'll never give up on it.
Hi, my name is Dr. Michael Snyder. I'm a board-certified chiropractor and laser therapy specialist with a bachelor's degree in athletic training. I've been practicing chiropractic since 1993, treating families, professional athletes, and weekend warriors, as well as people with work and auto-related injuries. I offer a very personalized approach to my patients' overall health and wellness by combining the benefits of the Gonstead chiropractic technique, Class 4 high-power laser therapy, orthotics, active release technique, which is a soft tissue system, with postural correction and stretching and strengthening to give you the best chance of achieving and maintaining your personal health goals.
Hey, my name is Pat Phillipson. I got referred to Dr. Petraglia. I'm a fighter, pro fighter, MMA. I've been doing this for 7 years. I jumped off something and jammed my ankle pretty bad and injured my C7 in jiu-jitsu. Dr. Petraglia is taking away the pain. I've been to numerous doctors, and there's no comparison. Dr. Petraglia is the best.
My injuries are basically associated with my football career and excessive hitting and excessive weightlifting, which has eventually led to lower back pain. I feel great. I would recommend this.
It seemed like when I walked in with other doctor's offices, they hand me a prescription and maybe some small talk and we were done. Well, with Dr. Petralia, we had a plan. we went after it. We said, hey, let's look at some massages. Let's look at acupuncture. Let's do muscle testing. Let's do nerve blocks. Let's come up with something that is solid, and let's get you back going and feeling as good as you did before the injury.
Hi, my name's Colleen Galvin. I'm a physician assistant, licensed acupuncturist, and naturopath. I've been working in this field of alternative health and primary care medicine, pain medicine, for about 20 years now. The purpose of the multiple modalities that I use are to get at the core issues of why people are having pain. There are multiple ways to approach people's illnesses and pains, and I try to utilize and again get to the core by utilizing all the different modalities that I offer. So if you have any questions, I look forward to seeing you in the clinic sometime soon.
I'm a professional skateboarder, so I have my knees and my back and my ankles and my wrists and falling all over my body. So yeah, my knees feel really cool. I don't have any pain in my knees, which is the biggest thing. So I've been doing this for a while, and Dr. P's helped me a lot. So thank you.
Tell us about your experiences with chronic pain, and at least in terms of your sporting activities and your feet. And what therapies have you tried before?
You know, other than coming to you, really, doctors would just, give me my medication and pretty much send me on my way. We've tried, I think, 3 or 4 different procedures on my feet, and this by far is does the most for me. When I get out of bed in the morning, it's the first 15, 20 steps is just, it's really painful. And for about 2 weeks after this procedure, I mean, it feels great.
I ended up having a, epidural cortisone shot in my neck. Within a week, as the doctor had described, all of a sudden the pain was gone. I felt like a human being again. Work wasn't a chore, it was what I enjoy doing. I enjoy my work. I was treated professionally, courteously, and even more important, I was treated with healing. These people were truly concerned about how I felt, what was wrong with me. They recognized when I was uncomfortable, even before I said it, and either changed what they were doing or whatever. But there was just a general feeling of, this is a place you go to feel better. This is someplace where you're going to get healed. And that attitude probably was more important to my healing, to my getting better, than the techniques or the cortisone or anything else. It's just that people cared about me, people cared about making me healthy.
When I wake up in the morning, my pain used to usually be almost every single morning a 9 or a 10. Now, after I've had the injections and been doing the physical therapy, I wake up. Still am a little sore, but once I get up and about moving, it goes down to 2. Sometimes, I move around without any pain at all, which is amazing.
When I met Dr. Petralia, I think before that time, I did not think that even as a nurse, I did not think that there were any other options other than just going and getting injections. I thought that's all there was. I think that Dr. Petralia changed my life, and that's from here. And I would recommend Dr. Petralia to anybody because I'm out there, I'm working again, and I'm doing things that I really didn't think I would be doing.
I got my pain in my shoulders and my lower back from when I played volleyball. When I come in here, I normally have about it hurts about a 10 in my shoulders. I can't really lift them that much.
What's going on? I'm Kyle Loza. I'm 24 years old and I ride freestyle motocross professionally. I won the X Games the last 3 years in a row, and basically I've had 27 broken bones, 11 concussions, and most of them are from riding motorcycles. A small chunk are from skateboarding, but some of the more serious ones are I broke my jaw on both sides, had my mouth wired shut for like 3 months, and then I broke my right ulna 4 times, my right radius, left ulna, left radius, both legs, my left ankle, 5 ribs, a lot of stuff like that. Just endless amounts of just broken bones and bruises and cuts and a bunch of stuff like that. Yeah, since I've been with Interventional Pain Medical Group, I've been feeling a little better. I actually started riding after my first time coming here, and basically just trying to get back on track so that I could go back and get competing again as soon as I can.
I guess when I got in here, it's probably like a 5.5 right now, but it was like a 7 or 8 right when I was walking in.
Where's most of the pain right now?
So
show me where most of it is. Can I get a Sharpie, please?
It's like, see that red dot on the right?
Mm-hmm.
It's like right above that.
Above that?
Yeah.
Okay, so that's a significant concern right here, this area.
Yeah.
So we'll look at that under x-ray. We'll try to identify if there's maybe a screw that's poking through on the plate. This comes off.
Whatever's inside me right now is amazing.
The quintessential point of the finger indicating the pathology, of course. Cortex of the bone looks. Ulnar head maybe causes some irritation.
It's like everything went according to plan, and about 90% of my arm's numb right now, so it's not feeling terrible. But yeah, I mean, I'm just excited to see how it feels in a couple days, if this thing's working or not. Everyone was super cool. Everyone was really nice, and you know, they took care of me.
Okay, well, now that you've seen what our patients have had to say, please feel free to make the call. Our phone number is 866-804-PAIN. That's 866-804-7246. Our website is www.gotpaindocs.com. GOTPAINDOCS.com. Thank you.